Good
Hey.
evening, everyone. My name is Sharon Moreno. I'm a family nurse practitioner, and we have my super awesome co-host, Ray Martinez. Welcome back, Ray.
Hey, well,
How are you?
thank you. Thank you. Yeah, I was real busy. I finally fixed my schedule, guys. So, welcome to Let's Talk Health with your host, Sharon Moreno, and myself, Ray Martinez. Brought to you live with all the goodies from Go Rush Health Solutions, where we will dive into real talk, the real issues. Tonight, guys, we have an absolutely amazing show with real solutions to protect you, empower you, and of course, our community. Tonight's episode, guys, is bold. Is bold. So make sure you get your popcorn and sit back and relax because, man, it's going to be awesome. But it's necessary, guys. We're going to be talking about STDs. And yes, it's uncomfortable for some, but silence is more dangerous than the truth, guys. Let's drop the shame, pick up the facts, and protect our future. You owe it to yourself and to others, to those that are part of your circle, your family members and all that, and you need that to be informed. So grab a notepad, guys. Invite a friend. Let's talk health. Let's talk about the many things that we're afraid to say but need to hear, guys. So take it away, Sharon.
Absolutely. So we always start with a legal disclaimer before every show. So I'll post that up. So this topic was actually recommended by someone who watches my show. So I'm excited about that. You know, when you ask for topics, I try to offer them. So
Yeah.
again, please, if there is a topic that you have an interest in, um, it's important. Let's get those submitted to me so that we can try to accommodate whatever topics of interest you are. So again, this topic was recommended, and so here we are talking about it today. I do have a couple of comments to start with, and there's Diola, my faithful listener. Hi, Diola, how are you? Good to have you again for this particular show. We have a comment for you, Ray.
All
They're
right,
looking for
Norma.
you.
How's it going? I'm here. So yeah, it wasn't me.
There you go. I
so
fired
Sharon,
fired you for Monday. Sure.
yeah. So, man, STDs, man. STDs, one thing is that STDs do not discriminate, man. STDs affect people of all ages, races, genders, sexual orientations. You can't be in a long term relationship and still be, I mean, you can be in a long term relationship and still be at risk. Many STDs show no symptoms. How true is that? I mean, people, they always talk about, oh, well, yeah, I caught this, and then say, well, I sat down on the toilet and all that, and sometimes that's true, and sometimes I don't know, but I don't know. I'm not the expert. I'm just repeating what I see on television, what I hear from people, and a lot of times we don't have this type of conversations. They don't come up. No one says,
Sure.
dude, let's go grab some coffee and talk about STDs. Nobody, everything's
I
hush hush.
agree. I agree.
You know, I even when they talk to you, they kind of like, well, I want to lose some weight, STDs, and I have a heart problem, STDs, and it's like they don't even want to talk about it. I don't know.
Sure.
So
I agree.
teach us, Sharon.
Absolutely. So, I like to start with statistics. I am a
Yes,
statistics kind of gal.
yeah,
So,
there are.
let's start with that. So, I have two pieces of statistics here for STDs. And by the way, STD stands for sexually transmitted diseases, okay?
Oh man,
STDs. So, we have 1 in 5 people have a sexually transmitted disease. So, if you're in a room and there's 5 people, one of those people likely have an STD. So, this is pretty common. I see this quite often. The second one is the most common STD is human papillomavirus, which is HPV. We're going to get into what HPV is later on in my slides. As soon as we get to that, I will tell you, okay, remember, this is the STD that was the most common. So,
wow,
you know, you would think it's more gonorrhea or chlamydia, but it's actually HPV.
HPV. You know, happy
Mhm.
person victory.
Yeah.
All right,
And I
keep
know
it.
that That doesn't necessarily mean much at this point, but as we get into the slides, we'll figure out what these things are together.
There you go.
So we'll start with overview. I like to give an overview of things. So general information regarding STDs. They pass from person to person in blood, semen, vaginal, and or other fluids.
Wow.
They can also be spread to infants during pregnancy or childbirth, blood transfusion, or shared needles. So there's quite a few ways that people can get STDs. Okay, that's the important take from there. The next piece of information that's extremely important is that they don't always cause symptoms. And so multiple people may have these infections, may be giving it to someone else because they don't necessarily know that they're infected. So it may be a knowledge deficit. For the most part, people tend to be reactive and not proactive. So I feel great. I don't see my doctor. But if you're proactive, you see your doctor annually for your labs. You tell them I'm sexually active. I need my annual STD panel. Again, I know you touched a little base initially saying that if you're in a committed relationship, that you should assume that all is good. I tend to do STD screenings anyhow. I'm not sure there's a such thing as a committed relationship. You know what I mean? Like you're in control of yourself, but not necessarily in control of the other person. And so that those you need to take care of yourself. And in order to really know what your true situation is, it's best to get lab work done and testing at least once a year. Or if you suspect that a partner's ill or a bunch of new partners. Again, symptoms may appear after just a few days or years. Again, that's kind of the issue, is that there's a lack of many times initial symptoms. And when they can present a year down the road, or years, I should say, down the road. So that's sort of the issue with that. So let's talk a little bit about symptoms, why people come into the clinic or with their healthcare provider. No symptoms. That's kind of the big issue. Absolutely no symptoms. So you may live your day-to-day life without an absolute symptom and be infected with an STD. Things that are more obvious are these to follow, where people do come in because they're like, something's not right down there or anywhere. So we have things like sores or bumps on the genitals or in the oral or rectal area, painful or burning urination, discharge from the penis, unusual or odorous vaginal discharge, or unusual vaginal bleeding. So these are some symptoms. Again, most of them are focused in the genital area, but they can be outside of that, especially if you have sores or bumps. Those can be on your mouth, depending on where the contact was. Again, there's multiple, there's oral sex and anal sex and, intercourse the normal way. And so essentially what happens is, depending on where you were infected at, that's where you're going to have lesions or problematic areas from. So again, these are some symptoms mentioned, and we have more. So we have pain during sex. We have sore, swollen lymph nodes, particularly in the groin, but sometimes more widespread, depending on what STD you have. Lower abdominal pain, fever, and rash over the trunk, hands, or feet. Again, these are worrisome symptoms. And so people tend to go into the clinic and say, hey, I have this problem. Now, remember, if you have sores on your skin, that doesn't necessarily mean you have an STD, or an abdominal pain. Oh, now I have an STD, or fever. Again, these symptoms, you need to go to your primary care provider and say, hey, I'm having these symptoms. I want to be evaluated. I'm not sure what's going on. And your healthcare provider should be able to help sort things out, because there's so many different symptoms that one can have. So let's talk a little bit about causes, how STDs come about. So they can be caused by bacteria, which include gonorrhea, syphilis, and chlamydia. These are examples of STDs of bacterial etiology, meaning the cause of this STD is a bacteria.
Wow.
You can also have parasites. An example of a parasitic STD is trichomoniasis. Again, these illnesses may not mean much at this point. And if it doesn't, great. If you've heard of it, either your healthcare, or you may have had the illness yourself, or you've had a partner with this sort of illness. So if you haven't heard about it, it's probably not a bad thing.
It's good.
But we'll talk a little bit more about these things as we go into the slides.
Cool.
Viruses, that's another area as well. And examples of this is HPV, the human papillomavirus. Remember, just this is the most common STD we talked about a little earlier. Herpes simplex, and the human immunodeficiency virus, which is HIV. And this is pretty well known. This is the virus that causes AIDS, which ultimately causes a demise. Back in the days, if you had HIV, that was pretty much a life sentence, a death sentence. Now people are living many, many years with HIV, and they look very good. HIV had been associated with people who were very skinny, who had ulcers, and just didn't look good. But now, it's a common person in the public, and you really can't tell them apart.
Wow.
So let's look at some risk factors. What places an individual at higher risk if they have, for getting STDs? So again, the obvious, having unprotected sex. This includes vaginal or anal sex with an infected partner who isn't wearing a latex or polyurethane condom, as well as not using condoms correctly. Oral sex is slightly less risky, but still, you can still spread the virus, the bacteria, or the parasites if there's no condom or dental dam that's being used during oral sex. Again, the issue here is there's sexually transmitted diseases, and so obviously unprotected sex is going to be a high risk. Having sexual contact with many partners. So the more partners you have, the more risk you have for having STDs. Again, we know what we're doing and we know who we're seeing, but we're not necessarily sure what the other person is seeing. And so again, it's really important to be in charge of yourself always. Having a history of STD. So generally, if you've had one STD in the past, you're at higher risk for getting STDs again. And it happens because having this history just makes it easier, placing your body more susceptible to getting sick and these STDs taking hold. So again, unprotected sex, multiple partners, history of STD. We'll continue with with other risk factors. So being forced to engage in sexual activity, rape. We're not necessarily sure where, we're not necessarily sure the person who's obligating the sex. We're not sure of their medical history. And so that's somewhat of an issue. Are they raping people because they're ill and they're not able to have, intercourse normally with people? Are they drug addicts? What's the reason for them, to be doing this kind of, participating in this kind of behavior? Misuse of alcohol and recreational drugs. Again, if you're not in your right mind, then you tend to do risky things,
Yeah.
We always have to try to be in control of ourselves as much as possible. We talked injecting drugs. Again, some of these drugs can be bloodborne, and so if you're sharing needles, then that's an issue, and places you at risk for STDs. And simply being young, so people aged 15 to 24 tend to be a bit more promiscuous and more risk-taking, and so for that reason, these people, individuals from 15 to 24 years old, seem to have higher risk for STDs.
Yeah, because they're curious.
Not only are they, not only are they risk-taking, but they tend to, again, as I mentioned, have more partners, tend to engage in sex with different partners.
Wow.
So let's look at some complications of STDs. So if we don't treat STDs, what can happen as a result? So quite a few things. It's not just the genital area. There's quite a few issues with this. So you can have pelvic pain. If you're pregnant, you can have complications. Plus, you can transmit it to the fetus. You can have eye inflammation, arthritis, pelvic inflammatory disease, infertility, and/or issues conceiving and either getting pregnant or impregnating someone, heart diseases, and certain cancers. So it's important that we treat the STD, not only because we're trying to prevent the spread of the infectious disease, but we also don't want complications. And they tend to
Yeah.
these tend to create different complications. So we have to be aware of that. And I have a couple of comments here. Christina, hello, beautiful.
Christina,
Hi,
how's it
Christina. How are
going?
you? Thank you for being a faithful listener of ours. We also have Manny, another faithful listener. Hi, Manny. How are you
Hey,
doing?
Manny, how's it going?
Um, so complications, right? Now, I have quite some interesting pictures now.
Wow.
Some people may not be excited about this, but I will say that there's pictures of genitalia. So if you're afraid of that, don't watch from now till maybe about 8 or 10 slides. And if you're shy, then I guess send a shy emoji. I don't know. But I will say I work healthcare, and
Close your eyes.
don't. I really don't have much of a shy bone in me when it comes to health related topics. You know,
Yeah.
it's extremely important to educate people, and the only way we're going to do this is by talking about it.
Yeah.
And
Well, that's
so,
what it is. That's what this show's about. It's about health and it's about our bodies and, how we can be in touch with it and, get to know the things that we don't know. And so, who best than somebody that understands it. So you're the expert.
sure.
Teach us.
I've seen plenty of STDs, plenty. This is not something that's uncommon. This is pretty common. And so these treatments are, something that I tell people nothing to be shy about. If you're having a problem, come see us and we'll get you taken care of. The last thing we want is people feeling uncomfortable and not seeking treatment, but still engaging in sexual activity and
Hmm.
infecting a bunch of other people. That's a bit concerning. So we
Yeah.
have gonorrhea here. Remember, gonorrhea is one of those bacterial ones. This is a pretty common STD. I've seen this one quite often. As I mentioned, it's bacterial. And these pictures show some of the symptoms that may be associated with gonorrhea. So on this top left, where there's a red circle and white area there, this is a picture of a cervix. So when we do pap smears and we look inside the vagina, we see the cervix. Now, if it looks like this is a problem. It tells us that something not great is happening. So with gonorrhea, we have things like, if it gets in the eye, then you can end up with this red eye infection here and this drainage on the right side of that eye, that white milky drainage from your eye, you can end up with that.
Hmm.
And this is one of those STDs where symptoms are not common at all. For the most part, people go asymptomatic. So a lot of times
Wow.
people don't know that they have this particular illness. But when they do have symptoms, it's usually this white mucopurulent discharge from the penis or the vagina. If you look on the very top, right in the corner, in the right upper corner, there's a picture of the tip of the penis with some white discharge. So it would look something like that. And on the very bottom, you'll see that's a picture of the labia majora, the vagina, where you can see the white discharge there. So when you do have symptoms and it's discharged, people will tend to go into the clinic and be like, hey, I have something leaking and it wasn't there. So that'll warrant a checkup. If there's no symptoms, then people tend not to know anything. So not know anything's going on. And again, being reactive versus proactive aren't going to know.
Mm.
So again, this is something that's easily treated. We give Rocephin injection with this, and this is taken care of. Now, this is something that we have to report to the health department. There are certain diagnoses, certain infectious diseases that we need to report because they keep track of these infectious diseases, and this is one of them. So we have patients that come in with gonorrhea, then we have to report that to the health department. Treat and report to health department. I think that's really important. A pearl here is we want to talk to the patient and tell them, look, you need to contact sexual partners that you've had over the last 60 days, and they need to be evaluated. Now, if the patient doesn't necessarily want to do it for whatever reasons, then sometimes I help them say, okay, are they patients that you've come into, I mean, people, I'm sorry, sexual partners that you've come into contact with and don't feel comfortable telling them, then we can reach out and say, hey, I just want you to know that someone came in to see me. They tested positive for an STD. Would you like STD testing either from me, um, which I would charge a fee, or they can go to one of the clinics and try to get something that's free of charge, if possible, depending on what their funds are. But that's
Yeah.
really important. We want to get people, they come in and they say, hey, my husband, I've been sexually active with my husband, and I tend to just write them a prescription for the husband. I don't necessarily need people coming in if they've had intercourse with them, then likely or I shouldn't say husband, but the spouse is infected. So that's gonorrhea. The next one here is chlamydia. So gonorrhea and chlamydia a lot of times go hand in hand. If we treat for one, we usually treat for the other one. We usually assume that they're kind of, partners. And so, yeah, they're kind of in that same realm of illness, if you will. Again, they're pretty common. Both of these are pretty common STDs. And the symptoms are actually quite the same. Either no symptoms at all. So again, we have an area like we have people who are symptomatic, and then we have things like this left picture here to the left where it has like a circle and red area there. Again, this is what we see when we do a pap smear. This is a cervix that's red, which is
Wow.
easily bleeds. So we refer to that as friable. When we go in there and look, it's friable. In other words, any little uh, manipulation causes bleeding. That middle picture is again a friable uterus with that same white, thin, milky discharge. And then we have on the right hand side, again, this is in the eye. So this is chlamydia in the eye where you see someone with an infection. And Christina has a
Mhm.
comment here. Let me see what she says. She put easy way to stop it. Stop sleeping around. And like my dad would say, close your legs.
Better
Better
safe
safe than
than
sorry.
sorry. Sí, es
You
verdad.
know, yes, I'm going to piggyback off of that comment in a medical way. And the way I would say that is abstinence. So that's basically what she means here. Even if you use a condom, there still can be micro tears. It can slip off. It's not placed on correctly. Then yes, absolutely, you can get STDs. But I'm going to tell you here, even being in a relationship with one person, again, I have to say, we know what we're doing, but we can't always know what the other person is doing. And so,
Mm.
really the way to 100% prevent STDs is abstinence. And again, we talked about a few other ways, like blood transfusions and drug use. And so those are some other things that you'd have to abstain from as well, in conjunction with abstinence.
Yeah.
So chlamydia is also another bacterial infection. So we have syphilis. Syphilis is one of those that has three different stages of illness: initial, secondary, and tertiary. And you may see things at different stages, but this one tends to have more symptoms. If you look in the bottom right corner, you'll see like an ulceration on the penis. This is called the chancre. So, and right above it is a ulceration on the vagina, on the vaginal, I'm sorry, on the labia majora, so outside the vagina. These ulcers appear and they're painless. So that's really what we focus on. So somebody comes in, they're like, I have this ulcer here, but it doesn't hurt. Then that should open our eyes to possibly this is a chancre, which is related to syphilis.
Mm.
Because most times you get ulcers anywhere on the body and they're quite painful. You bite your lip and you have an ulcer there, or you have something anywhere on your body and they're going to cause some sort of discomfort, whether it's an itch, a burn. But in this case, these chancres don't cause any pain at all. So that's, again, this is one of those STDs where ulcers happen and people come in like, it's frightening. Anything that happens to the genitalia, people tend to run in and ask, okay, what the issue is, what's going on there, and get that sort of thing squared away. So, and then we have this rash on the hand also that can appear. This picture below the hand is the anus. So this is a chancre that's around the anus. Remember that these chancres come out where the exposure happens. So if, there was anal sex, then we would see something, or you'd see something around the anus. If it's intercourse, then we'd see something on the penis or the vagina. So, these are things that we look for, and we know, okay, if it's in this area, this is where this is happening. And I want to say one thing that's really important, that these anal ulcerations don't always come on homosexual partners. They happen a lot of times on heterosexual partners. A lot of heterosexual partners are engaging in anal sex, so these things can happen on completely straight people. Now, the treatment for syphilis is penicillin G. Again, this is one injection, one and done. Unless you're pregnant and you have more than one. If we go back to the chlamydia, I didn't talk about that treatment, but that one is doxycycline. So this is an oral treatment. And again, if you end up with gonorrhea, then we want to treat for gonorrhea and chlamydia. And if you end up with chlamydia, then we can treat for chlamydia and gonorrhea. Again, those are hand in hand. So the third one we have here is trichomoniasis. This is one that's parasitic. This is a parasitic STD. Now, this one, people usually come into the clinic right away, for the reason being the symptoms are not exciting. So you'll have yellowish, greenish discharge that's thin and copious. So there's a lot. I mean, it's not something that, okay, it's one small drip. I mean, this is a leaking faucet. So this is quite a bit. And then you'll have, especially in women, you'll have this fishy odor. They'll complain, I don't know what's going on down there, but there's this bad odor, or there's this fishy odor. And so they come in quite quickly complaining of these sort of things. Now, the treatment for this is a flagyl. We give them a course of that, and that usually resolves the issue.
Wow.
Yeah, so this is human papillomavirus. This is the most common STD there is. So we talked about 1 in 5 people having STDs, and we talked about the most common STD being human papillomavirus. This is a virus, and the human papillomavirus can have 2 symptoms that are quite devastating. I've seen these, and they're not exciting. People definitely come in quickly. So warts, we'll see warts around the anus, we'll see warts on the vagina, we'll see warts on the penis, and or warts around the mouth. So, and these are ugly warts, and usually they're not one, they're a bunch of warts. I have seen people come in with their penis covered with warts, with the anus covered with warts. And so, yeah, it's quite devastating.
Wow.
These people are probably going to be having intercourse in the dark, because it is extremely obvious. I mean, honestly, even in the dark, you feel them because they're bumpy. They have a very rough texture. And so they're quite obvious.
So warts, don't touch it.
Yes.
Run
Now,
away.
if it's in the genital area, yes. If you have like on your hands, or your feet, that's a different story. But if it's around your mouth, or if it's on the genitals, yes, this is an STD, and this is communicable. Wow. So the other issue with human papillomavirus is that it can cause cancer, and that's a quite devastating issue, because it can cause cervical cancer, and a lot of times males are the carriers of this particular gene, and they carry it they transmit it to multiple females. So the males tend to have worse symptoms, and females end up with the cancers and warts. So luckily, this is one of those viruses that can be tested again with annual screenings when we're doing pap smears annually. Again, that's the whole reason for annual checkups. You want to get screenings done. Once you become sexually active, we start pap smears. And so through the pap smears, they'll be able to tell you if you have HPV. Now, back in my days, there were no vaccines for HPV, but somehow, again, through tracking of different illnesses and STDs, it was realized that, wow, this is devastating to people. Not only the wart part, I mean, the wart part is, a physical thing, but the cancer, people were, dying of these cancers that were caused from HPV. And not only that, not only cancers, but, people end up with hysterectomies, abnormal pap smears as a result, and it causes a lot of devastation. So
Wow.
they created an HPV vaccine, and that can be gotten from teens all the way up to the age of 26 years old. So I tell people, make sure you're getting your vaccines, because the last thing we want is cancer, especially from an STD. It'd be devastating to end up with warts and cancer. And some
Yeah.
people do, because there's so many different strains of HPV.
Hmm.
The next one, this is super common as well. I have seen this. This is another virus. So this is herpes simplex. We usually call it genital herpes. Um, so we see warts, we don't want to engage in that. If we see blisters, we don't want to engage in that either, because people are communicable when they have the blisters. Once those blisters rupture and they subside, then it's safe to engage in that. But I'll be honest, if I see anything that's dried and crusty, I'm probably not going to visit that area. Just because, I mean, it's you're better safe than sound. And so uh, I've seen this quite often. So if you have something that looks like blisters, this is painful. So people definitely will come into the clinic or come see me and say, hey, I don't know what the heck's going on down there, but I have blisters in these areas. They can get them around their mouth, and again in the genitalia. For this, we use Valtrex, um, Valtrex or a cyclovir, an antiviral medication to help with this. Now, herpes can be long-term. That's somewhat the issue. People can have it now and then have outbreaks. So they can stay with this particular virus. And so for people who have quite a bit of outbreaks of these blisters, we tend to put them on suppressive therapy, meaning we put them on a medication to help prevent breakouts. If not, then they're going to end up with a bunch of breakouts. And again, during that time, that's when you're communicable. You can give this to other people. So for the fact that we want to control infectious diseases, we
Mhm.
tend to do that. Now, with breakouts are like once a year or with stress or whatever, then, we tend to just, okay, we'll give you a treatment as needed as you have the breakout, but, we don't have to keep you on a scheduled dose of medications as a result.
Yeah.
Um, so Valtrex, a cyclovir for this. For HPV, so we remove these warts. You can scrape them off with a machine, or there's certain creams that you apply there and kind of like eat this flesh. I'm going to tell you, I've treated people myself for these warts, and you put on these creams and medication, and this tissue just sloughs off, and it smells quite bad. And it's a slow process. So it's not something that's going to go away right away. So the process is quite long, and can be quite embarrassing and devastating, especially if you have sexual partners, because they're going to have to be uh, maybe having to help you with this, especially if they're in areas that are hard to reach, like the anus.
Mm.
Um, and the last one here is HIV. So this one is pretty common to everybody. This is another virus. Um, you know, HIV has a variety of symptoms. It can it can be from feeling fatigue, from weight loss, from getting sick frequently, quite a few things. But this here, I decided to put pictures up of something called Kaposi's sarcoma. So these I've actually seen on patients as well. And this is a rash that's pretty distinct with HIV people. It's this strawberry-like appearing rash that's red. Some people complain of pain and others basically say there's no pain, but this can be, when I saw it on the patient's foot soles. So somewhat like this second picture here, but it can be anywhere on the body. Um,
Wow.
Again, now with our medications, there's great outcomes. People are living much longer and just doing really well, living regular lives to the point where they're actually able to have intercourse again without protection, in the sense that there's medications to bring them to seropositivity, meaning that they're not communicable, they're not shedding the HIV virus. So that's something that's new, because again, back in the old days, if you had HIV, you were contagious, and if you weren't using protection, and or you were, but something happened with that protection, then someone was going to be in a bad place. And now, again, as I mentioned, HIV has great outcomes. It's no longer a death sentence. There's HIV clinics that specifically treat these patients and follow these patients. You can get free testing there. You suspect that you've been exposed to somebody who, has a questionable history, or you've been advised that, what, I'm now positive, go check yourself. Then you can always go with your medical provider and they can help you. If you don't have funds, then you can always go to the AIDS clinic in Harlingen or the health department and ask for free testing.
Wow.
So that's something that's extremely important there. But that's that for the pictures of these STDs, and again, for HIV, there's multiple treatments, multiple treatments. So, see, it wasn't that bad, was it?
No, not really. But you know what? It's necessary because a picture, like as I say, it tells 1,000 words. It just takes you where you need to be. Where you need to go. You need to see it. Sometimes a picture is better than, hey, you shouldn't do this. You shouldn't be engaging in this. And they see the picture and they go, yeah, you okay? I'll stop that behavior. And so yeah.
Absolutely. Yes. Yeah, pictures do, if you show these pictures to someone, they can be like, oh, that doesn't look like something I want to,
Yeah.
engage in. Again, some of them are worse than others. The good thing is that there's treatment, but some can have devastating effects. And so we need to be aware that when we're choosing partners, it's important to be vigilant and to ask questions. It's okay to say, hey, how many sexual partners have you had over the last 60 days? Because again, that has to do with STD testing. Or when's the last time you got tested and do you have those results? I don't see
Mm,
anything wrong with asking about, people's statuses, because again, we have to protect ourselves. We're in
yeah.
charge of ourselves. I have a
Yeah.
comment here from
Safety
Juliana.
first.
She says, hi. Hi, Juliana. How are you? Thank you for joining us.
But yeah,
So,
it's safety first, guys. It's your life, it's your future, it's your uh, it may affect your next relationship. You know, uh,
absolutely.
so yeah,
Absolutely. Yes. Especially if you end up with something like let me put this back here. Especially if you end up with this particular one here.
yeah,
Herpes can you can end up with having this in your system forever, where you have outbreaks. And now, as a result, you either have to be on suppressive therapy, where you have to take a medication, or you're going to be in a place where they pop up sporadically and you'll have to take as needed. So that's one that's concerning. Even though there's great treatment now for HIV, it's still a concerning, illness and diagnosis. You have to take quite strong medications. They have side effects. Anytime you have to take a medication for any illness, we always have to understand that it's a poison that we're adding to our body, and we're choosing that because the risk outweigh uh, the benefits. The benefits outweigh the risk for doing that. Otherwise, we wouldn't be, engaging in that. But syphilis is another devastating one.
Mm.
People can have heart-related problems. They can have um, uh, psychosis and stuff as they age. And so again, that's another one that's quite devastating. Some of these can cause infertility. So if you're looking to have a baby and or conceive, then these STDs affect that particular um, area. So again, these are things that are important. It's best to be proactive versus reactive. Guys, the important thing is that you always ask questions. If are not sure of, I have this symptom, I need this resource, please feel free to text me. My text is here on the flyer. My cell phone, it's 956-640-6963. That's my cell phone. Text me. Tell me who you are. Tell me what you need. I don't charge people for asking questions. I charge people for treatment. So if I'm going to provide a treatment to you, of course, I'm going to charge you for the treatment. But if I'm answering questions, you need resources, community resources or something, then please feel free to text me, use me as a community resource to help you with your needs. You can reach me by text or you can message me on Messenger and Facebook under Sharon Moreno. You can also there's a messaging system through my website at goldrushhealthsolutions.com. Go on there, look at the services I offer. On this flyer, I post the most common ones, which are the weight loss, the vitamin B12 therapy, steroid joints for pain, and antibiotic injections. But the reality is that I treat all sorts of things. So if you have a question, if you have a doubt, message me. I'm here
Hmm.
to offer support.
No, and that's good. Your range. I mean, you're not gonna advertise, "Hey, I do STDs," or "I'll take care of your herpes problem," or "Hey, come on over and we'll take care of your
Yes,
gonorrhea." I mean, come
there
on.
you go.
That's not, you're not gonna see that on advertisement. But this is important because the thing is, you need to protect yourself because protecting yourself is self-respect. So one, condoms and regular testings are acts of empowerment, not distrust. Respecting your health means respecting your future. As this, the question here is, why do you find it easier to have sex than to have conversations about protection? And it's so true. Maybe perhaps we get into the emotional and the mental toll of STDs beyond the physical. STDs often bring shame, anxiety, and guilt, right? Which can delay diagnosis and treatment. We need to
Sure.
find support. And the thing is, are you more concerned about being judged or being healed? And that's the thing. That's why we do these shows. Or I mean, that's why Sharon's doing these shows and bringing her knowledge, because you know uh, uh topics like this, they got to come under a health show. They can't I mean, Sharon and I used to do shows before on Talk Show Central RTV style, but quite frankly, this would not be a topic we would touch. I mean, we were talking about
Yeah, no,
COVID
we
back
we
in the
get
day, but something like this is, it takes somebody that knows how to explain it, somebody that knows how to deal, and somebody that's not afraid to, one, give you the answers, but to talk about it. Because come on, we all hear a lot of our education comes from what we call the locker room education. Growing up, you hear this, guys talking to guys, girls talk. I'm sure girls talking with girls, and what you hear and what's not even real, and that's the knowledge that we take in to all of these all of these relationship and STDs that nowadays are more common. I'm sure they were there back in the day, but we had no knowledge of it. I mean, we were younger, and now everything's out. So use Sharon as your private medical guru.
Sure.
And so,
Absolutely. And again, it's an important topic. Someone recommended it, and in healthcare, I don't find much shame. Honestly, I've been doing
yeah,
this for so long, and so I feel quite comfortable speaking about almost anything. And so, if the public has a curiosity or they want a specific topic, that's why I say, hey, voice whatever topics you're interested in. That way we can I can work and gather this information, because if you're asking for it, to me it's important, and I'll provide that. STDs are quite important. It's, I think our culture kind of sees it more as like taboo, even the
yeah.
sex part taboo, hush, don't say anything, it's very private. Even things around girls starting their first period,
Hmm.
it's just all of this stuff is just like so secretive. And all of a sudden you have the young woman that has this period and is bleeding. It's like, what the heck is going on? Oh, you're a young lady, okay, fine. But there's no explanation beforehand. There's no talk with from the parent to the child saying, hey,
Yeah.
they have a son, tell them about using condoms if they're speaking to their daughters. Also protection, also birth control. All of these topics are extremely important, but I think that the culture is kind of big in, again, secrecy and taboo. And so people just kind of like hush hush with these sort of things. And so I like to bring awareness. There's no hush hush with me. If you have a question, I'm going to answer. If you want me to look at something, I'm going to look, and touch and whatever needs to be done. I take these things very seriously, and I've seen many STDs, as I mentioned. And I'm not here to shame anybody. I want to find out, okay, let's give you a treatment, and do I need to treat other people? It's about reducing the spread of infectious diseases. I don't care about people's sexual preferences or people's sexual practices, unless it's something illegal. But I'm there to do a job. I want to make sure that people are getting treatment, and again, to stop the spread of infectious diseases. That's really what's important to me. Reporting the disease to the authority itself, because we have obligations
Yeah.
with particular diagnosis. But people do reach out. I've gotten a lot of questions, about random things, not necessarily an STD, but just a bunch of random things. And so we're talking about STDs today, but I just want you guys to know that, my text doors and my messenger doors are always open to questions. If it's a medical question, I'm happy to help you with that. That's really important to me. And again, I don't charge. I'm not here, charging people for questions or, consultation fees. I only charge if I'm going to give you a treatment.
Great, 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 great. So, wow, man, time flies, man. This is pretty cool. I don't know if any of you viewers have any uh comments. Post them either on the YouTube channel or on the Facebook. Uh, are any comments you want Sharon to talk about? Hey, we'll bring it out there. I mean, again, this will tell you, man, the Sharon will talk about whatever is going to give you a benefit, because it's about
Absolutely.
your health. It's about your health. And a lot of times, whether it's something like this or something, having to do with your heart, something to do with one of your organs, or lungs, whatever, bladder, uh, you know, whatever it may be, hey, you might not have the answers, you might not even have the questions, but you have a feeling, oh, my leg hurts, oh, my back hurts, oh, my arm hurts. And don't discount it. Don't I know it's just something that's going on, I slept wrong. Sometimes it's more than that, and it's better to be safe than sorry, as the so hey, it's make the call.
I
Make
agree.
the call.
I agree. To me, no question is ever stupid. I answer, I give responses to questions, all questions that are all medical questions that are asked. That's really
Yeah.
important to me. And Juliana says, She would like a topic arthritis on the back. Okay, so arthritis is
Órale.
generally a great arthritis is a great topic to talk about. And actually, I've thought about that
Mhm.
because I do treat a wide variety of patients with arthritic pain. I probably wouldn't focus on the back itself, but I just talk about general arthritis, which includes the back. So yes, absolutely. That's I can definitely discuss arthritis, even pain, but arthritis is super common. Arthritis is one of those things that people tend to think um, is something that old people get, but the reality is that it's a wear and tear syndrome. So you can have people who are 20-year-olds with arthritis.
Wow.
They live a rather aggressive lifestyle, like they do skateboarding and play rough sports. Then you can have
Hmm.
people who are in their 20s or 30s with arthritis. Again, it's a
That's
wear and
interesting.
tear syndrome. It's a wear and tear syndrome, and that's something that comes as a result of age. Now, obviously, the longer you live, the more miles you put on your odometer. And so, yeah, the joints have been used more. So, yeah, they tend to happen in people who are older, but it's not the age that necessarily causes that. It's the wear and tear that happens
Yeah.
as a
Yeah.
result.
That makes sense. That makes sense.
Yep.
So, wow. So cool, man. So guys, before we close tonight, pause and ask yourself, what's scarier? What scares you? Knowing the truth or living with the consequence of what you never asked? STDs don't wait for permission. They don't care about embarrassment. They move in silence and thrive in your silence. But you have the power to break that silence, guys. Get tested. It doesn't mean you're guilty. It means you're responsible, guys. Talk to your partner. It's not going to ruin the mood. It protects your peace. Learning more today could save your life tomorrow. So, guys, again, it was a great show. Thank you, Sharon, again. And, the facts are in your hands now. And when you know better, you can't go back to pretend you didn't know. So take
True.
control, take control, choose courage because your health isn't just your business, it's your legacy, man. So let's talk health with Sharon Moreno, where we talk the truth, break the barriers, and protect lives. Uh,
Sure.
so, guys, you know, give us the likes on the Facebook page. Gold Rush Health Solutions. Subscribe to the YouTube channel, and we'll be here next week.
Sounds good to me. Thank you, everyone, for seeing us, and we'll see you next week.
Adios.